Due to increased urbanization, road crashes are inevitable, but ability to provide quality pre-hospital trauma care at the scene of such accidents is critical to reducing fatality. To improve access to this life-saving care and reduce burden of road crashes, the Lagos State Emergency Ambulance Services, LASAMBUS, was established in March 2001. But how is the agency faring more than 22 years after its establishment? These and other related issues are the focus of Inside Lagos this week. Welcome to Inside Lagos. I'm Adedoja. Salam Adeni. Due to rapid urbanization and industrialization, road traffic crashes and other emergencies are inevitable. According to data from the World Health Organization, about 1.19 million people die every year due to road traffic crashes. 92% of the global fatalities on road occur in low and middle income countries like Nigeria, which has an annual mortality rate of 20.6 deaths per 100,000 people, compared to the United States at 10.8 deaths and the United Kingdom at 2.9 deaths. The need for improved access to emergency care and ambulance services to cater for such accident victims necessitated the establishment of the Lagos State Ambulance Services, LASAMBUS. It is a product of the visionary leadership by Bola Tinubu when he held sway as the governor of Lagos State between 1999 and 2007. Established in March 2001, LASAMBUS is a Lagos-based ambulance transport call center with the objective of providing pre-hospital care services in case of medical emergencies.
What we're trying to achieve with LASAMBUS is a pre-hospital ambulance service that can respond anywhere in Lagos within 30 minutes. And we're also hoping that we can guarantee the people of Lagos that the ambulance that will come to them will be fully equipped with state-of-the-art equipment, and that the staff that will come in that ambulance will be highly skilled and up to date with the knowledge of all the latest techniques for saving lives.
About 23 years after its establishment, LASAMBUS continues to provide basic first aid and emergency services to accident victims from its operational bases and ambulance points located in strategic places across Lagos before they are moved to the appropriate hospital.
It's gone through different phases of its life, but over the last 4 years, we've expanded our ambulance service. We have brand new ambulances now, which includes a fleet of transport ambulances and what they call mobile intensive care units that have a lot more sophisticated equipment. And now they're able to start providing treatment in the ambulance even before a patient gets to the hospital. So basically, they've largely impacted pre-hospital care, and the response time has shortened to accidents, RTAs, and people just collapsing on the road. So I believe they have added a lot of value to the healthcare space in Lagos State.
An accident and emergency nurse who is also a specialist in mental health, Beatrice Makinde, is the director of LASAMBUS. She has been working in LASAMBUS for more than 20 years. The job of Makinde and her colleagues at LASAMBUS is a critical and endless one. LASAMBUS operates from 8 bases and 28 ambulance stations to cater for emergency needs of residents in every corner of the metropolis.
C3, take a message.
Inside Lagos crew caught up with her at the center in Lagos State University Teaching Hospital, LASUTH, regarded as the alpha base of LASAMBUS.
Good morning, my sister. How are you doing? How's everything?
Fine, thank you.
C3, come in with your message. I can read you. Sorry, I just have an emergency call. Okay.
Before we could settle for the interview, she got a distress call regarding a fire accident.
LASAMBUS 3, confirm the distress call you are going to.
Delta 1, there's a fire incident at Church of David. Adeni Jones, Ikeja.
Message confirm. We'll be on our way. Time go and over and out.
It's so early in the morning. Is this how you receive calls on a daily basis?
Yeah.
Wow.
So they are leaving already, so we'll go with them.
Okay, that's fine.
So do you want to join us? Okay.
Yes, I would like to join you.
Okay, come. Buhari, please, I need an ambulance for them.
I joined the team on a ride for the operation.
Confirm the location again.
That's Church of David. Adeni Jones.
Okay.
Out of David Church. Adeni Jones. By organizer bus stop.
While on the way, she keeps tab on the operation.
I can read you loud and clear.
Each of the ambulances on the fleet of LASAMBUS is well equipped.
These are oxygen compartments. These are the 2 oxygen cylinders. Because sometimes you might be attending to a patient with 1 oxygen cylinder and it got finished. You just switch to the second one. And these are the flow meters that will bring out the oxygen. Take it easy. Why is driving like this? Because we are going on a distress call to save life. But you should be careful so that we too will get there alive. These are the flow meter. This will tell us the level of oxygen to give. If it's an adult, you can give 4 to 6 liters, depending on the age of the patient. If it's a child, between 2 to 3 liters, depending on the condition of the patient again. And these are infusions that we use for the patients.
The scene of the fire accident was the household of David Church, located on number 7 Surulere Industrial Road off Adeni Jones Avenue, Ikeja.
Okay, that's the entrance.
By the time the LASAMBUS team arrived at the scene, men of the Lagos State Fire and Rescue Services had put out the fire.
Hello. Good morning, sir. I'm greeting you.
Ma?
Good morning.
Morning, ma.
Yeah,
Sorry.
please, how do you see our response? Are we so prompt?
I don't know when they called you, but
They just called
it's
us.
okay. They just called you.
Yes.
It is okay for at least something like this is happening and there's an ambulance around.
Hello? Please, we are government officials. Good morning, sir. Good morning, sir. Yeah.
When did this happen? What time? Around what time did this happen? Just an hour ago, and it's just done like this? Wow. This kind of affairs, what is the work of LASAMBUS? Because I can see the fire service are already here trying to...
You know, normally when there is fire, we expect casualties. One, it may be from the people that are quenching the fire. It may be people that are running scatter. It may be people that are trying to help. Sometimes we see some of them with laceration. Even sometimes they have bruises. So once there is fire, the emergency response has to be on standby.
There was no casualty, but the damage had already been done to the church.
So what could have caused the fire, the damage, a lot of things to this extent? This is a very big one.
Nobody is sure from here. I think the people outside saw it first from the roof. So maybe a spark, maybe something, because we've been there for 4 years. So we don't know exactly what could have been. But definitely, I think it started from somewhere different, so it must be a spark. But we were just busy working inside, and the people, from the outside there, you'll be able to see them. So they saw smoke and they
For Mrs. Makinde, the services of LASAMBUS go beyond road traffic crashes and fire accidents.
What are the other things, other emergencies that you attend to?
Yeah, sometimes we have collapsed building. So, people might be trapped in the collapsed building. Then when the people are retrieved, then the emergency will be on standby to either treat them on the spot or transport them to definitive care where we are referring them. Then sometimes there may be collapse. Maybe somebody is walking and suddenly collapse on the road, or people that have emergencies in the house. Maybe somebody just stopped breathing, or probably the person get choked, or the person just slump at home. Even some may be sick, maybe with malaria, and they couldn't walk. So they can call our number 767 or 112. So that's medical cases. We group them under medical. Then sometimes we have obstetric cases. Probably a woman goes to the market and delivered or wants to deliver, so they call us.
The collaboration between the fire service and LASAMBUS.
Yeah, because we are all emergency response team. Normally when there is fire, you expect there will be casualties. Either people trapped and are retrieved, or either people that are rescuing, becoming a patient, or people trying to severe some of their things from the incident, they can get injured. So the emergency ambulance will be there to cater for those patients.
From there, the team moved to another base of LASAMBUS.
So where's our next port of call now?
Now we are going to toll gate. That's LASAMBUS 1. Which is under base 1 last week. Because it's on Lagos-Ibadan Expressway, and we record most of our accidents on that route. So, and most times when accidents occur, we'll be called, and then we'll respond to the call as they come.
So you resume in the morning, do you have any closing time?
Yeah, we work 24 hours. So we resume 8 a.m. We expected to close 8 a.m. the following morning, but if you're on a response until when you resolve it, before you can close, because it's possible that...
When do you close from work?
We don't have a definite time to close, especially when we have a patient we are handling. Probably you might be 8 o'clock and you are in Orile Agege with a patient. You can't drop the patient there until when the patient is received from you and is admitted. The patient is not received from you, we take patient as far as Badagry. So we only know when we resume 8 a.m., which is 24 hours, but no closing time.
Just like journalists.
Because of the nature of the job. Okay. So, okay, thank you.
But while heading to the toll gate ambulance station of LASAMBUS, another distress call came in.
I can read you coming with your message. Location of the line down.
This time, a woman was said to be lying naked on the street. Then all roads lead to Ojodu. And the third distress call came in, an accident, but another LASAMBUS team near the Maryland area took care of it.
There's an ambulance going there, so but let's see this one there.
And another one again, an old man found in a gutter at Makoko.
So I want to catch a video. So one to buy DNC, MRI, one shall go.
A team cared for him.
LASAMBUS 1, take a message.
We eventually got to number 4 Yakoyo Road, opposite Ashafa bus stop, Ojodu, and found the woman lying unconsciously by the roadside.
Good morning. Okay. Oh yeah, what's up?
Personnel of LASAMBUS swooped on the woman to resuscitate her. After some minutes of treatment, she was revived.
Oh yeah.
I called to inform about the situation because when I came in the morning, I came around to 11. I met her unconscious. And I found out that she has been here before 7 o'clock. So I couldn't wait and look at her like that. And within few minutes, they were all here. In fact, I'm surprised to see 3 ambulances at the same time. So God bless you. We are very, very grateful.
Mrs. Makinde said cases of people being dumped on the roadside have become common in Lagos.
She was being beaten, and we can see the mark of the beating at her back. She was semi-unconscious. We bathed her. We set up her IV line, normal saline. We checked her SpO2, and it became 98, which shows that she's now conscious. As we can see, when we are moving her, she sat down and she was even saying thank you to the crew. So these are cases we go through every day. And like what we heard from the onlookers, we learned that they dump her here overnight, that she has been used for ritual purposes, according to bystanders. Now we've resuscitated her, and we are taking her to trauma center, where she'll be stabilized for further transfer to a definitive care. Daily basis, we can have 3 to 4. We will be called for an emergency purposes, so we don't know who dumped them. We don't know when they will be dumped. Even some bring their victims to the road for the government to take care of them, because they know that our governor, Babajide Olushola Sanwo-Olu, is doing a great deal in taking care of his citizenry, because health is for everybody, and that's what you have just seen.
Okay. Let's go. Ma.
The woman was transferred to a trauma center for better treatment and care.
Rorao.
We stopped by the Folari Coca Clinic, located within the Lagos State Secretariat, Alausa. This place serves as an administrative base for the agency, where data are stored and analyzed.
If you work without a data, shows you are not doing anything. And this Folari Coca staff clinic too, some of the staffs that fall ill, maybe at work, even some come from their home. Even we transfer patients from here to other hospitals.
Okay, talking about data, can you give us statistics of how many people you respond to, whether in a year, in a month, or thereabouts?
Yeah, for last year, we were able to rescued, treated, admitted over 3,000 victims.
3,000?
Over 3,000 victims.
In a year?
Yes, over.
From there, we moved to the Lagos State Ambulance Point at the toll gate access of the Lagos-Ibadan Expressway.
To ensure that LASAMBUS delivered on its mandate of providing care for the ever-increasing population, the state government established ambulance stations in strategic locations across Lagos metropolis. And one of the ambulance stations is this one located here at the toll gate area of the state.
It's one of the oldest points, which we refer to as LASAMBUS 1. And this LASAMBUS 1 is under base 1, which is in Lasut. And the staffs will leave the base by 8 o'clock to the point, and they'll get here sometimes 7:45 or 8:30, depending on the traffic on the road. When 767 or 112 is being called, the control and command center, LASAMBUS personnel there will direct the call to the nearest ambulance point, and the response time that is acceptable worldwide is at least 10 minutes. But because of the road network and the traffic congestion, sometimes it may increase.
For effective service delivery, LASAMBUS has 38 ambulances stationed at strategic locations across Lagos.
During the NSAS, some of our points were vandalized, and 5 of them now had been renovated by Save 1 Million Life. It's a federal government project, and they've been able to renovate the ambulance point for us, which was constructed during our president, Asiwaju Bola Ahmed Tinubu, who was the one that has the initiative. And our governor, Babajide Olushola Sanwo-Olu, has done a great deal by providing us with ambulances Right now we have like 28 functioning new ambulances and well equipped with our staffs that are well trained in BLS, ACLS and defensive driving for the drivers. And also we have from our donors grant unit that gave us 8 new Iveco ambulances. 8, yes. Our governor bought 10 new mobile intensive ambulances for us, and we are still expecting another one from the Global Fund. Presently we're having 33, but with the new 5 that we're expecting in a month's time, it will make 38.
Another important base for LASAMBUS is the Lagos State Accident and Emergency Center, toll gate.
Yeah.
Well done, ma.
Yeah, this is Accident and Emergency Center, which is Lagos State Accident and Emergency Center, and is referred to as Trauma Center, and is dedicated for Lagosians who are involved in road traffic accidents, especially on the highway, and they need medical attention.
The center offers free, prompt, and high-quality emergency healthcare services for the people. The medical director of the center, Adeolu Arogundade, said they have not deviated from that mission.
We were commissioned in 2010, and since that time we have seen about 40,000 patients. Many of them have come to what we call between life and death. So lots of them are unsafe because our mortality rate reduced well under 2%. So they've all received 100% free care. Whether we are transfusing that blood, whether we are doing minor surgical procedures, whether we are giving them medications or doing radiological services, 100% free service paid for by the Lagos State.
Most accident victims treated by LASAMBUS are referred to this facility. At the female observation ward, we saw the woman revived at Odudu getting more treatment.
Hello, what's your name?
It gladdens Mrs. Makinde that another life has been saved by LASAMBUS, which for her is a passion. At the male observation ward, 2 of the patients have pathetic stories. Adam Jimo from Mukene in Kogi State has been receiving treatment at the center for more than a month after he was knocked down by a hit-and-run driver in Aja area of Lagos. He said he has nowhere else to go.
I don't even know how they brought me for here. I surprised the next day that I saw myself for here. They now told me that she's motor that he hit me. Like this, who am I going to call? And I didn't have any parent for this Lagos here for me to call. And now talk to the Oga that they should find way of the other so that they will take me to my family. When I reach my family, they see me like this. They can't reject me. They will know how to do.
The story of Segun Omo-Ogun, a native of Edo State, is also depressing. The 75-year-old man has spent more than 3 months at the emergency center receiving free Medicare.
So suddenly I just see that my body changed. Even the brain, everything, affects my heart and my legs. So later they found out it's stroke.
Stroke. So who brought you? Policemen.
When I fall on the road.
When you fell down on the road. Okay, so what about your family members?
No, really, it's the wife we spoke with. He gave us the number, we called the woman. The woman said over 40 years now they have separated, they are not together, that she can't come. How about your children? They didn't disclose any number, but the social tried to call some of them that he was able to give, but nobody responded.
It was a full operational day for Inside Lagos crew and LASAMBUS.
For a vibrant city like Lagos, providing improved access to emergency care and ambulance services is a Herculean task. Hence, perception is critical to ensure that people key into this program.
The awareness is better than before, but the problem we have is the populace. Because when the ambulance is on distress call, they hardly give the right way to the ambulance. Lagosians, some will say they don't have anything in the ambulance, they are just blowing the siren. And with Lagos State Ambulance Services, we don't just blare the siren if we are not on distress call. It's either we are going to pick a patient or the patient is within the ambulance.
No doubt, the Lagos State Ambulance Services, LASAMBUS, is doing a yeoman's job serving the people. In case of emergencies, just call 112 or 767 for help. With continuous reform of the Lagos State Emergency Ambulance Services, LASAMBUS, by the Lagos State government for improved trauma care, residents can play their own part by observing traffic rules and regulations to reduce road crashes. And that's all we have for you on this week's episode of Inside Lagos. Many thanks for being a part of it. I'm Adedoja. Salam Adeniyi.